It's my distinct honor and pleasure to introduce our next speaker, Tarek Zidan, who's MSW and PhD, and he's an assistant professor at Indiana University in South Bend, focusing on mental health policy. This session is going to be a little different because Tarek is going to speak initially for about 15-20 minutes. We're going to save 5 minutes for Q&A for him because he has another session to get to in the other track, and then we'll carry on with the panel after that. So without further ado, please help me welcome him with a very warm round of applause.
Thank you. Good morning, everyone. Assalamu alaikum. I'm presenting today a study. It's about the stigma toward people with developmental disability among Arab Americans. And this is the first national survey and study on the United States, in particular targeting the Arab Americans. There are several studies that measuring attitude toward people with developmental disability among Chinese Americans, African American, white Caucasian, other minority, but this is the first study in the United States that targeting Arab Americans and their attitude toward people with developmental disability. It was a large sample of 372 sample size. This is an overview of the presentation, which is why I'm doing the study introduction until we'll end it with the conclusion. Why I did this study? There is two reasons for this study. The first one was actually personal, which is when I, as an introductory person said that I grew up in Egypt, actually. When I grew up in Egypt as a child, I used to hear noises coming up from the basement. And every time I ask a grandfather or mother, who's that noise that is coming from? Is there somebody living in the basement? Actually, I found out I have an aunt. She's much older than me, and she's developmentally disabled, have autism, but she kept left alone in the basement. They just bring food for her 3 times a day, and she cannot see anybody. Nobody knows that we have a family member who is disabled. Because what? Because of the stigma that attached for the disability. The second reason is professional. Professional when I immigrated to the United States in 1999, I went to graduate school at Washington University in St. Louis. I studied particularly mental health policy and research. And then after I graduated, I moved to Colorado, where I served the people with developmental disability for 10 years as a social worker. So, and I devoted my dissertation as well to study the same topic, that developmental disability and the attitudes of Arab Americans toward people with disability, which is the most likely is be negative if we coming from our countries, like the main countries, like in 22 Arab countries. But if we grow up here, we might have like different attitude toward people with disability. The background actually is why I'm doing this study. Also, again, what the background is, there is a large stigma and stereotype, a negative attitude toward people with disability among Arab Americans. Also, the person with developmental disability are various between culture to culture, from the Chinese culture to Arab culture to African American culture. Social scientists have begun this study, the stigma and the attitude toward people in general in 1960s, and also disability rights movement tried to protect the people, human rights, and also people with disability. Deinstitutionalization movement also tried to give more integrity and more integration of the disabled into the community. Disability models. When I looked at the different models of disabilities, there is 4 different models you can see here that explain the view or the attitude toward people with developmental disability in general in the society in the United States. The first one is called the medical model, which is, this model is actually looking more negative view to the people with disability, as they look at them or view them as the people are sick, like they need medical attention or medical treatment. The second model is called the social model, which is pretty much views a person with disability as a social problem, a social malfunction in the society. The third model, which is we call it a moral model, looks at or views the person with developmental disability as a sinful, someone has a sin or even an evil blood or an evil spirit that can result to have a child who's a disabled or you are a disabled yourself. The last model is called the affirmative model. That's the only model that views disability as a positive view. We call it the disability pride, which is view disability as an important part of the society and as a contributed citizen to the society. So they are not really actually being viewed as a negative or a stigmatized, but actually being as a positive. So all three models here are looking at the disability as something negative rather than positive, the affirmative model. When I have some numbers here are some data about the magnitude of the problem or how many people with disability nationwide and also in the United States and globe. We have about 1 billion people around the globe that have a disability, 45 million in the Middle East alone, and in the United States we have about 11 to 18% of people who have disability. In the study, there is a differentiation between who's the Arabs and who's the Arab Americans. The Arabs actually, who are the people who are immigrated from the 22 countries of the Arab countries. See, this is a map of 22 Arab countries of Arab League. Arab Americans, the people who are really actually being naturalized citizen or being born in the United States, and they became an Arab American. How many Arab Americans living in the United States? We found that the US Census Bureau estimate is 1.8 million, but actually this number actually is not maybe reflect is the real number of Arab Americans, especially post 9/11. Many Arab Americans tried to hide their ethnicity or race. They don't want to be identified being an Arab or even Muslim because of the backlash. But the Arab American Institute in 2012 actually, and estimated is about, the larger number is about maybe about 3.7 million Arab American living in the United States. And maybe the number is even higher than this. When I done the survey, here is like who's the Arab American living in the United States, how many percentage. You can see the difference, race and ethnicity. You see Egyptians at 10%. You see what they claim that Arab or Arabic 15%, Lebanese at 26%, and so on. These are, when they said Arab or other Arab, some sample that they don't want to identify themselves as an Arab, as an Egyptian, or as a very ethnic community or ethnic country. So they even say that we are Arab or other Arab or Arabic. So they don't want to identify being one of these other 22 countries. A statement of the problem. What is the problem of statement here? Stigmatization and marginalization of people with disability is widespread in the Arab culture. Negative societal attitude toward people with disability, and also lack of cultural competency among the social workers and practitioners. The purpose of study. The study actually describes the attitudes of, what is the attitudes overall of Arab Americans, and also trying to explain the variation in their overall attitudes with regard to social contact and also acculturation and socio-demographic characteristics. The study also purpose examines the correlation between acculturation, level of the contact, and overall level of attitudes. The study investigates which factors that best predict overall attitudes of Arab Americans. Significance of study. Why the study is so significant? Because it highlights the Arab American community in the literature, to fill out the gap in the literature, as well as increase the awareness of social work profession and adding a new knowledge to the knowledge base about Arab Americans and their attitudes. Enhances the cultural competency movement among social workers and practitioners. Also educate the Arab American families about the stigma toward people with developmental disability that exist in our culture. When I looked at the literature review, I found a little research have been done with regard to the Arabs with Arab American or Arabs with toward people attitudes or negative attitude toward people with disability. There's only a few studies that done in United Arab Emirates, Saudi Arabia, and maybe Lebanon or Jordan, but the majority of non-Arab studies that have been conducted, as I mentioned, among other minorities like Chinese, Korean Americans, and Native American and African American and so on. So these are the main three elements that I found that the literature are talking that factor contributed to the attitude toward people with disabilities. Socio-demographic characteristic, level of acculturation, level of the contact. Socio-demographic means like all these kind of factors that like age, gender, income, level of education, employment, all kind of different factors that can be found under socio-demographic characteristic of Arab Americans. Level of acculturation, people who are living in the United States for longer time, they are more acculturated, more integrated into the US society and the mainstream cultures that might have different attitudes than people who are less integrated or less acculturated into the mainstream American culture. Level of the contact, the people who are contacting with people with disabilities, they have more likely to have more positive attitudes than people who does not have any contact with people with disability. This is a theoretical framework, which is the theories that that underpinning the study. There is three different theories. The first one is symbolic interactionism theory or labeling theory, which is this theory is talking about how the people view other people, how we label other people by even physical appearance or even by accent, or people how they view people with disability as well. Ecological perspective of personal environment, how this theory actually underpinning the study based on the personal environment is within several systems, main system and their subsystems that they look at each other and how they also perceive each other or view each other based on the disability as well, and how the person physically or even mentally or developmentally disabled. Acculturation theory that also undermining the study, talking about the people who are the more likely, the more acculturated, the more likely develop more positive attitude. When I'm talking about the method here section, this is a cross-sectional design, research design, which is the sample size was 272 participants that being collected online using a Quartlic survey, and the survey was translated into Arabic as well, so it was available in English and Arabic. And the convenient sample, it's a convenient sample, an online survey as I mentioned, and also the inclusion, which is non-disabled, older adult, 18 and over, who been identified as an Arab Americans. And also there was a raffle for an iPad Air, so one person won the raffle from the state of California. And also the data collection was, as I said, self-administrated by the survey and from the 22 Arab American organizations nationwide in the 50 states. The data analysis included descriptive and multi-data analysis or inferential statistics. These are the surveys that I used the acculturation, Vancouver Index of Acculturation Scale, which is Arabic, modified Arabic version, which has 20 questions. 10 questions asking about the Arab Main Street culture heritage, and the other 10 questions asking about the mainstream American culture. The second scale that I used is called Contact with the Disabled Person, and pretty much is a multi-dimensional scale that asking several questions about the level of the contact with the person with disability. Attitude toward the person with developmental disabilities, this is another scale that I used in the study, and this is multi-dimensional scale, has 24 questions. It has 5 levels of the level of measurement, and these are the scoring and also the alpha level or reliability. as I mentioned on the side here. And also I use the demographic questionnaire that the one have 12 questions that cover the socio-demographic questions and items in the survey. So I use 3 validated, reliable skills. The first one, the acculturation, contact with the person with disability, the attitude toward the person with disability, and 1 demographic questionnaire for the study. What is the research questions? Research question, actually the main overarching research question is what the attitudes of Arab Americans toward person with developmental disability. That's as simple as is. And then there is 3 sub-questions. These are the sub-questions that here are listed. The first one are there is a statistically significant relationship between the level of attitudes of Arab American toward people with disability and socio-demographic characteristics. I mean, I'm trying to find out if there is any statistically significant relationship between the overall attitudes and different characteristics like age, gender, level of education, income, employment. The research question 2 is, there is a statistically significant correlation between Arab American level of attitude toward people with disability and level of acculturation and level of the contact. So if there is any significant relationship correlation between attitudes and level of acculturation or contact, the people who having more contact might have a positive or negative attitude. People who are acculturated in the United States even more maybe have a positive attitude toward people with disabilities than people who are less acculturated. And then the last research question, sub-research question, is what the set of factors, what the factors that can predict the attitudes of Arab Americans among all these factors. Remember, we have I have three different scales, that validated scales, that everyone that talking about different factors, and we have a demographic also questionnaire as well. So these are 72 questions are included in the whole study. So I want to see what prediction, how can I predict attitude toward people with disability? As a result of the study, as I said, this is a large number of the sample size in 50 states. These are to give you an overview snapshot of what the demographic for the study. I mean, the large number is female, Muslim, U.S. citizens. They have a bachelor degree, married, annual income of a higher income, employment. And if you see here, this is the sample, and this is the national sample, which is the national sample of Arab Americans. So I compare between the demographic of this group of my study with the national Arab American sample population. And you see here the socio-demographic characteristic. You see these are the people who are country of origin, who are fill out the survey. 65% they said they came from the Middle East, 3% others, and then Northern Africa 32%, and this is from the United States. You see the numbers. I need to go quick because I have the time is just very short for the long study. This is a major finding actually. There is no significant correlation between age and attitude, that is contradictory to the literature review. Literature saying that younger generation have more positive attitudes than older generation. But in this study, it's found like age is not really actually significant. But what is significant is income. The people who have a higher income have more positive attitude. Also, people who are staying longer in the United States, they have more positive attitude. And if you see here, the one in yellow, that is the one that has the positive attitude or significant correlation between attitudes and this particular 3 different variables. Talking about females versus male, females tend to have more fibroid or more positive attitudes than males. And then higher education, the people with higher education, higher level of education have more positive attitudes than people with lower education. employment, people who have a full-time job, they have intended to have more favorable or more positive attitude toward people with disabilities than the people who are unemployed. With regard to religion, this is very interesting because you see that Druze became the least favorite, people like the most negative attitude toward the Arab Americans, but it seems here the people who claim that atheists, like they don't believe in any kind of religion, are actually showing more positive attitudes than either Christian or Muslim population on my sample size. But this result is only limited for the sample size. So it's not, we cannot generalize. But this is very interesting because it seems like Christian and Muslims are supposed to be in literature. It said like Muslims have more positive attitude toward people with disability, even Christian as well. Most of religion are. But in this study, it's only showing the easiest that the people didn't believe in any kind of religion. They have the most positive attitude toward people with disability. Significant immigration, the people who are really U.S. citizens are having more positive attitudes than people who are not U.S. citizens. Arab Americans, native, that they are actually born in the United States. The Americans who are born in the United States versus the Americans who are not born in the United States, they have more positive attitude. Acculturation, the people who are claim that they are acculturated with mainstream American culture, they have more positive attitudes than the people who are really acculturated with or still stick with their own culture while living in the United States. Level of the contact, the more contact people that have with the person with disability, the more positive attitudes they have rather than the people who never have any contact or low or less contact. Significant, this is the significance of how, this is at the end, I want to predict what the factors over all these factors can predict the attitudes of Arab Americans. I found that acculturation was mainstream culture. General contact, length of stay, education status, born in the US, being Christian, all these variables or factors that can predict with the attitudes of Arab Americans. What's the limitation of the study? The study has several limitations. As I mentioned, it's a convenient sample, which is not random sample, and also the cross-sectional study, which is there is no longitudinal study. It's only done once at a time, at one point at a time, and also social desirability, which is the participant can fill out the survey in a way which is satisfy the researcher, and also it's an online survey which you cannot verify the information who fill out the survey. So there is a lack of generalizability. You cannot generalize the result, but only you can generalize the result to the sample size, which is 372 people that being filled out the survey. Implication for what is the implication for the study? Implication for practice, actually this will help the social workers to enhance the knowledge base and the cultural competency movement, that they understand more about the cultural sensitivity and what the attitudes of Arab Americans, also better understanding of Arab American culture, giving in-depth information about the Arab American culture, educate the Arab American families about the attitudes and negative attitudes that happen in the Arab countries back home, for research actually to fill out the gap in literature about the Arab Americans and their attitudes, for the policy which is help the decision making to provide more culturally sensitive programs and services and policies for Arab Americans. Recommendation for the future study. I would like to add, this is a cross-sectional quantitative study. I would like to add a qualitative piece to it, like conducting focus group, in-depth interviews with the sample of Arab Americans. Also, I would like to do a comparison study with Arab Americans and different other minorities like African American, Chinese American, and compare between the result. Or doing also a more in-depth examination of take a sample of some Arab countries like Jordan, Palestine, Egypt, and the Middle East, and compares the sample of the Arab Americans with some sample in the Middle East. And also explores the Arab Americans, actually their attitude towards seeking help and treatment for people with developmental disability. It's the same like the mental health. Like, we know that there is a large, widespread stigma against using and seeking help and treatment for mental health in the Arab country, even in the United States as well, from Arab American point of view. So this is the same thing. I want to do the study actually to try to seek, to explore this kind of area of research of seeking treatment and help for the Arab Americans who have a child who's disabled. I think I'm done here. If you have any question, I'm sorry I have to go rush. It's a long project with a large sample size, so I try to cover it up as soon as I can.
Thank you very much. Let's give him a very warm round of applause. And I think we have some brief time, a couple, 2-3 minutes for questions and answers. So we'll
yes.
start with you.
Is the project funded by the government?
No, this is a dissertation actually. This is my own dissertation. It's self-funded, and even I bought my from my own money the iPad, which is a $500 an iPad Air, and shipped it to California because one person won that iPad as incentive for filling out the survey. But I am the one. I developed the quarterly survey.
Very good, sir.
And then
That's commitment. I like when, that's very nice. Spending your own money on
Yes.
this is beautiful. Yes.
You mentioned the fact that it's not a longitudinal study, that it's a limitation in the study itself. How would you design a longitudinal study?
what? I'm sorry?
How would you design a longitudinal study for these questions? Would it be that you want to show correlation and change over
Sure.
time? Or?
Yeah, this study, as I said, is a cross-sectional study. So if it's like this is a longitudinal study, actually I will repeat the study in several times, like in 6 months, and then compare between different, like I can divide the Arab American by region, like Northwest, Southwest, Midwest, and I can compare and I can test it and test it again, like several, I can run the survey in several times in longitudinal period of time, which I can compare between the result over time. Because when you're measuring something, especially the attitude, it's important you can compare over time between the result, because that is, and then you can pretty much get a credibility, like validated of your result. Not only one time, because you never know. When somebody fill out the survey, you might have a bad day, and, or somebody had a bad experience with a person with disability, somebody or a neighbor or something. So that's it. But when you do a longitudinal study, pretty much you verify the information more accurate, and especially when you measure the attitude, you have to measure it over time.
We have time for one more question. Yes.
I think to answer that, longitudinal study, it's not enough just to measure 6 months, a year, 2 years, but you have to have some kind of treatment therapy to see that change. Because if I take Middle East today and the Arab American 6 months ago, that doesn't mean that just you added more data. But really you need to see that the word longitudinal is comparing something after the fact, something happened. And that's probably something like education, for people, the Arab American or the other population, how to perceive people with disability. If that education changed their attitudes, then you can compare it to different time in the past or the future.
To clarify, my question wasn't what a longitudinal study is. It's more, what are you trying to measure? Are you trying to measure with acculturation that, in fact, there is a correlation between being more understanding of developmental disabilities over the course of a long time?
So he didn't do a longitudinal study.
No, I know.
Okay.
It was mentioned as a limitation.
Right.
So
Yeah.
I just wanted to clarify.
Yeah, and also I want to add, Dr. Abu Badr actually mentioned about the longitudinal. A longitudinal study, we use it mainly in experimental research. When you have a two-group design, and you have experimental group, and you have another group, it's called control group, and we have to develop what we call the baseline. You have a baseline, and then you have intervention or treatment, and then you do a follow-up, and then every 6 months you follow up. So you compare between the treatment and the baseline, and also the follow-up. And the longitudinal study in this case is very important because you're measuring or evaluate an intervention or treatment. Like I give you an example, like CBT, cognitive behavior therapy, okay? How this CBT can be effective reducing the level of depression. So if you have you need to establish a baseline, which is you testing 1 and 2 and 3 weeks, 5 weeks. And then the person will be sitting in intervention. You provide the CBT or the treatment, the CBT. And then you do the follow-up. And then after 6 months, you're testing again to see if his level of, the lower level of depression have been stayed in a level which lower is not like because of the intervention for 6 weeks that his depression went up or lower, but we want to make sure that CBT is really effective, so we test it several times over a period of time. And in this case, sometimes we use longitudinal studies.
All right, let's give him a round of applause again. Yes, go to this spot.
Thank you. I have to go to the other room.